Welcome to Adapt NCLEX Fundamentals of Nursing. Malpractice and negligence questions shows up again on the NCLEX. And the good news is most of these questions are just common sense. If you overthink it, you're going to get it wrong. The key is to know the difference between malpractice and negligence. I have 10 questions. I yield with rationale, detailed rationale, concept, mnemonic, how to tackle these kind of questions. By the end of this video, you master them, you read the question, and you know exactly the difference between them. Stick around, 10 questions, fundamentals of nursing, high yield, using good old common sense. Let's get to them. First thing, you have to know the details. Most important thing, how to approach this question. Every nurse has a duty based on what? Your scope of practice, right? If you breach this, something is going to happen. Breaching means you're not doing what you're supposed to do. The duty that has been assigned to you, you're breaching it. When you breach it, if there's a link, causation, that's what it means. If there's a link to what has happened to the patient and you cause harm to the patient, that becomes a full-blown malpractice. So what is these 4 words has to do with what we're going to talk about before we tackle the questions? NCLEX common sense trick, right? Negligence and malpractice. What difference do you see? Unsafe act or omission, because you have a duty and you fail to do it, that means you breach it, even if there's no harm. But there is a link to what you've done. But if the negligence affected the patient and there's a harm, it becomes what? Malpractice. This is your key. This slide, you take a picture of it, never forget it, and then you can use it to answer every question. So the mnemonic is what? Don't bring crazy harm to the patient. That is malpractice. Every time you see a question on what? Malpractice, tell yourself, don't bring crazy harm to the patient. That means duty, breach, causation, and there has to be an harm. This is the concept. Now, let's get to the question. The first question, use this to answer the questions. Which statement is true? The nurse, right? A nurse administers the wrong medication, right? That's breaching a duty, right? But immediately notify the provider. That's that. Save it and complete an incident report. The wrong medication was given, even though she notified the provider. That means a duty is to give a right medication. Stop the video. Therefore, what do you think is the right answer? The nurse is guilty of malpractice, common sense, right? Medication error occur. The nurse is negligent. Duty to give the correct drug was breached, right? The nurse will not be liable. The client was not harmed, right? No action is needed since the provider was notified. Test-taking strategy, common sense, fundamentals of nursing, using ethics and legality between what? Negligence and malpractice. Stop the video, put down your answer in the comment. This is the first question. I want to see if you got it, and put down your answer and say, I'm ready. What do you think is the right answer? This is the concept. Even if no harm has occurred, right? The medication error is a breach of duty. You have a duty to uphold. If you breach that duty, you committed negligence. There was no harm, therefore this cannot be a malpractice, and therefore the right answer is negligent was breached. The nurse is not liable for anything right now because there's no malpractice that has been initiated. But the most important thing is what? The nurse breached what? A duty. So harm, negligence plus duty. There's no harm to the patient, right? There's no harm to the patient. Now we know from the question. Therefore, this one, she breached a duty. We're going to use the same strategy. What does this represent? A client to develop pressure injury after a nurse repeatedly failed to position the client despite orders and standard of care. What does this represent? Battery, malpractice, negligence, and assault. Once again, stop the video, but use common sense. Use the key concept I've asked you, I've shown you. Go back to the question and read it carefully. A client developed, that means the harm has attacked the patient. Patient has now received the problem. She developed the pressure, he or she developed pressure injury. That means the final event has occurred. What happened? The nurse failed to what? Reposition the client, breaching a duty, and there is a causation, right? Of what? No, reposition the patient and causing harm. That's why I said don't bring crazy harm to the patient. This is a classic case of what? Malpractice. Therefore, malpractice, there's a professional negligence that results harm to the client. You see how you can master them. Failure to turn the or reposition the patient is a textbook examples of what? NCLEX malpractice. This is the way you can master them. Concept, fundamentals of nursing, negligence, ethics, NCLEX practice question. Number 3, which action by the nurse is an example of negligence? I just want you to master it. Like I said, by the end of this video, you see these questions and you breeze it. What do you think? Which action by the nurse is what? An example of negligence. We already seen it. Withholding a medication because the client refuses. What do you think? Failing to put up side rails for a sedated client leading to a fall. Explaining the risks of a procedure before consent. Reporting unsafe staffing to the charge nurse. All of them, think about it. Which one the nurse is breaching a duty? If you hold a medication because the client refuses, you've not breached your duty. Explaining the risks of what? The procedure before consent, you have not breached your duty. Reporting unsafe staffing to the charge nurse, you have not breached your duty. If you fail to do something, it's a breach of duty. That's negligence. Not implementing basic safety measures is a negligence. The nurse is negligent, and the harm occurred to the patient too. Therefore, we have a problem. She may get into trouble, and we will have a malpractice issue at hand. A nurse documents what? Client is drunk and non-compliant. The client sees the record and file a complaint. Common sense. What do you think? Fundamentals of nursing, ethics, right? What do you think? Sometimes they bring these ethical situation terms into malpractices and negligence. So watch for them. Which legal issue is that? Assault, right? And then negligence. She has not breached a duty. She just wrote something. Malpractice, no harm has been happening yet to the patient. Therefore, libel means what? Basically, defamation, information being put in the medical record and the patient does not like it. So written defamation is libel. The NCLEX love this, and therefore that's the right answer. Number 5, a nurse leaves the confused client in the hallway. You shouldn't do that without raising the side rails, breaching a duty, then or activating the bed, breaching a duty. The client fell, right? The falls and fractured the hip. There's a causation of the lack of what? Raising of the side rails, patient fall. So all the things that talk about has been met, right? We have what? You have a duty to take care of the patient, provide safety. You do not raise the side rails. As a result, the patient fell and the patient broke her hip, and all of the 4 things that's happened. Don't bring crazy harm to the patient. And therefore, the nurse is guilty of malpractice. The nurse committed negligence. The hospital is automatically liable. There is a sentinel event, but not negligence. Well, there is evidence of negligence. She did not raise the side rails up. Second, a harm happened to the patient. Patient hip was broken. That means clear malpractice has happened. So number 1 is the best answer. When negligence and injury together, we have malpractice. Which situation places the nurse at risk of malpractice? Same strategy. Following a provider order for a medication that the nurse knows is unsafe. It's unsafe medication. You know it's unsafe, but you breach your duty and you give it to the patient. Notifying the provider when a client status change. The duty was enforced. She saw something wrong and she called the doctor. Questioning a client before giving unfamiliar medication was concern and trying to investigate more. Refusing to perform a procedure outside the scope of the practice. She doesn't want to breach a scope of practice. Therefore, common sense tell you, you know the thing is wrong and you give it anyway. What else do you want? I mean, this is not rocket science. That is why I say more practice and negligence is common sense. Don't make it difficult. Separate it in your head. Something happened. You did something wrong. There's no ifs or buts. This nurse, what? Following an order that she knows is unsafe. You're still legally responsible to clarify unsafe orders. Blindly following them is a malpractice. You're in trouble. A nurse is caring for a post-op client. The nurse fails to what? The word fails. That is breach of duty to monitor vital signs for 6 hours, despite, that's the key word. Order for what? Do that. Your duty is to check every 6 hours. You breach it. I'm breaking down as we go, and you can see how you tell yourself. Don't read a question just like that. Bring the concept. NCLEX practice questions and answers, fundamentals of nursing, and test-taking strategy. As you read it, you say, okay, this is what is happening. The client developed shock and died. There was a breach of a duty. There's a causation. Patient died. This is an example of what? It's not negligence alone. Patient died. This is false imprisonment. 3 and 4 are completely wrong. This is irrelevant. Now you have to focus on 1 and 2. Negligence, of course, she was negligent, but patient died. That means it's causation. It's a causation to the harm of the patient. Therefore, this is a classic example of malpractice. Failing to monitor is negligence. And because harm and death occur, we have a malpractice issues at our hand. And then he tells the client, if you don't stay in bed, I will put restraint on you. That is bad. What is this considered? Negligence, she has not failed a duty, right? Is this an assault? Is it a malpractice or battery? There is a key concept here. You know, malpractice and negligence is out there. There was no breach of duty. There's no harm to the patient. She's just saying that he or she is saying, this is what I would do to you. If I touch you, it becomes a battery. But if I don't touch you, I just say it, I'm assaulting you. That's the difference between an assault and battery. Assault means you want to do something and you say it, that physically not touching the patient. If you physically touch the patient, you've committed battery. Therefore, this is an assault. Threatening to touch or harm the patient is an assault. But when you touch the patient, you committed battery. Which next action could result in professional negligence? You know all the things you're supposed to meet, right? Not checking NG2 before administering the medication. Your job is to check it before you give it to the patient. Ensure informed consent before surgery. She check it. Double checking insulin with another RN. Well, she check it. Reporting unsafe practice by the co-worker. She check it. You see the way I keep on going back to the basics? I'm not trying to confuse myself. Therefore, number 1, you do not check the thing. Failure to check NG2 placement before feeding is a negligence. Patient will aspirate and you get into trouble. Number 1. Last question. I know you got it. And then it refuses to give prescribed morphine because the client respiratory rate is 8. The respiratory rate is 8. I don't want to give you morphine because if I give you morphine, your respiratory rate go down and you die. I breach my duty. There's a causation of me giving you to you and you dying, and then I get into malpractice. Therefore, which statement is true? The nurse committed negligence. Well, she did not give the medication, refuses to uphold a duty. The nurse committed malpractice. There's no harm to the patient. Of course, you still having pain, but yeah, your respiratory rate is too low. The nurse acted appropriately. Of course, the nurse is guilty of abandonment. She did not abandon the patient. Therefore, number 3 is the right answer. Safe practice means holding the medication and calling the provider. This is the opposite of negligence. 10 questions, NCLEX practice questions, NCLEX questions and answers, fundamentals of nursing, malpractice and negligence difference. We talk about battery, we talk about assault and libel laws. These are simple, straightforward questions using common sense. Don't let them confuse you. Watch these multiple times. Put a comment. Let me know what you struggle with about these malpractice and negligence. But ethics and legality are your key for the NCLEX. Take care of yourself. And if you like more, I will link a video that talks about ethics, fundamentals of nursing lecture. And then that will help you understand all fundamentals of nursing regarding ethics and legality. Take care of yourself. Bye.